Welcome, Namaste, and welcome to Dr. Shahs Clinic. Okay, in another video on erectile dysfunction, we are going to answer the question, what causes erectile dysfunction in a man who's in his 40s, or what causes erectile dysfunction in an individual who's 40 years of age and above. Okay, erectile dysfunction is defined as the inability of an individual or a particular patient to sustain an erection of suitable rigidity adequate enough for penetrative sexual intercourse. So if an individual is unable to get an erection or is unable to sustain an erection to the extent that penetrative sex becomes almost impossible, then the individual is said to be diagnosed with erectile dysfunction. Now remember, an important point to bear in mind is all individuals, as they age, will experience erectile dysfunction at some point of time in their life or the other. And if you say you have tried sexual intercourse about 10 times and 15 times and 20 times, and if you notice you have erectile dysfunction in 1 or 2 attempts out of say the 20 times, you are not strictly a patient who has erectile dysfunction, and you really don't need any clinical evaluation of the same. But say you notice that you have a difficulty with sustaining erection in say more than 30% of attempts or 40% of attempts or more than 50% of attempts. If you repeatedly notice the same event happening over and over again, and if it's really distressing you, then it's the wisest thing to do is to visit your sexologist or andrologist near you and get properly evaluated for erectile dysfunction and treatment for the same. What are the common causes of erectile dysfunction for individuals in their 40s? Now, the most common, or I could say the top 3 common causes of erectile dysfunction for individuals who are in their 40s include 1. Diabetes mellitus. Number 2, systemic hypertension. Number 3, hyperlipidemia or dyslipidemia, which is nothing but elevated cholesterol levels. Now, what basically happens is erectile dysfunction is basically a marker of the man's overall general health status. Now, today, what we are seeing in the clinic is we're seeing a large number of patients who are coming into the clinic with erectile dysfunction. A large proportion of patients usually fall in the age group of anywhere between, say, 30 to 45. So what basically happens is with younger individuals, we see more psychogenic causes as common, along with smoking and cigarette abuse, alcohol abuse, and unstable relationships, which leads to erectile dysfunction. And with older individuals, we find older individuals are in more stable relationship, but they end up developing conditions like diabetes or hypertension or cholesterol issues. Or some individuals, older individuals, also develop something called as metabolic syndrome. So in older individuals, especially in individuals who are above 40, basically what happens is they have metabolic syndrome, which means they have a combination of hypertension, cholesterol, diabetes, along with a waist to hip ratio which is quite high, or a waist size that's greater than 40 inches and more abdominal fat in general. So individuals who are diagnosed with metabolic syndrome, when they develop erectile dysfunction, they are at a very, very high risk of coronary artery disease that can occur in about 5 to 7 years from the point of diagnosis of erectile dysfunction. So what's very important to bear in mind is if you're an older individual, and say if you have diabetes or hypertension or cholesterol, or you have all the 3 with excessive abdominal fat and a waist size that's more than 40 inches, and if you note that you have erectile dysfunction, please visit your sexologist or an andrologist for a proper treatment. Treatments for erectile dysfunction are fairly easy, they are fairly straightforward. All that we have to do is control your sugar, control your hypertension, control your blood cholesterol. And beyond that, we have to put you on some medications to improve your erection along with active lifestyle intervention. So that's all it takes. It's not very, it's not, the treatment of erectile dysfunction is not at all complex. It's fairly standardized, fairly easy to treat, but you'll be saving yourself a bucket load of problems because you're at high risk for coronary artery disease and future cardiac events. There have been a lot of studies. I'll be making a lot of separate videos on the topic. The link between ED and coronary artery disease is extremely well established, more so in patients with metabolic syndrome. So with older individuals, these are the things we actually look out for. And in some individuals, some older individuals, we also notice that, with increasing duration of relationship, because of other commitments, financial commitments, other familial commitments, sometimes there is sexual boredom that occurs between the partners. And that can also, kind of affect a man's erection. And sometimes there's a change in the overall body appearance. In the sense, for some individuals, what basically happens is initially at the time of marriage, the partner would have been, slim and would have, kind of fit in within the sexual fantasy of the individual. With increasing age or, multiple pregnancies for women tend to gain weight. So most of them or some of them, kind of get back into shape, but some of them really don't have the time to, get back into shape. And what basically happens is the overall attraction that the man has towards the woman also comes down. And this is something we also see quite commonly in individuals who have been in a long-term relationship. We find that the male partner is usually, or the male partner, kind of finds the female partner less attractive. Because of that, sexual intercourse does not happen between the partner. That is something which takes a much longer period of time to fix. Intensive counseling, behavioral therapy. We have to put the patient through cognitive behavioral therapy and medical therapy to kind of bring back the orientation that is required for the individual to engage back in healthy sexual intercourse. So these are all the common problems of erectile dysfunction, and in older men, especially in the 40s. And we also see some men in the 40s who are clinically depressed. Now, depression, in fact, there was a large study which was published from the Case Western Reserve University, from the Journal of Urology, and the paper had actually found that in older men, clinical depression can lead to erectile dysfunction in almost 11% of cases. So the study was done on almost 272,000 men, and they found 11% of individuals, 11% of 272,000 individuals actually had clinical depression that actually led to erectile dysfunction. Not just that, with older men and men especially in the range of 35 to 40 or 45, what we see is the usage of antihypertensive medication, use of medications like proton pump inhibitors, antidepressant, anti-anxiety pills. All this also leads to ED. The clinical literature is flooded with research on the side effect of these medications, and we know very well now that all these medications definitely contribute to erectile dysfunction. In fact, some of these men may already be on medications like statins, which are usually anti-cholesterol lowering drugs. Statins in itself can lead to erectile dysfunction. So these are some important pieces of information that you should bear in mind if you're about 35, nearing 40. And I hope you found this video informative. I don't want to kind of drag this video for too long, and I hope to see you soon in the next video. Please like, comment and subscribe. Share this video with all your friends and loved ones. This is Dr. Shah, and I'll see you soon in the next video. Bye.